Good morning, everybody. My name is Todd Higgins, and I'm your presenter today. I work at Disability Rights California, and I'm a senior advocate. And today our presentation is going to be on Medi-Cal Basics in 2026, upcoming changes. Disability Rights California is a nonprofit legal rights organization providing legal services for all Californians with disabilities. And we provide services throughout the state. Next slide, please. So this is a disclaimer. So the following presentation is meant for educational purposes only and does not constitute legal advice or counsel. Your situation may be unique and require careful attention. Also keep in mind that the information in these slides could become out of date as the laws and local policies related to these matters changes and they constantly develop. Next slide, please. So, what we're going to cover today, what you're going to learn. So you're going to learn what background information on Medi-Cal. You're going to learn about Medi-Cal eligibility, Medi-Cal programs for persons with disabilities, um, Medi-Cal services, Medi-Cal and other health coverage, applying for Medi-Cal, Medi-Cal appeals, and changes starting in 2026. Next slide, please. Okay, so some of the terms and agencies that we're going to be talking about in this presentation. Uh, um, so Medicaid so Medi-Cal is the Medicaid agency for California. So the federal program is called Medicaid. In California, it's specifically called Medi-Cal. So those terms can be used interchangeably, but when you're in California, the Medicaid program is known as Medi-Cal. Centers for Medicaid and Medicare Services, also known as CMS. Department of Healthcare Services, also known as DHCS. And they're the single state agency for Medi-Cal in California, and they can delegate to other agencies, such as for in-home supportive services or the Department of Social Services. Those are programs that are under the Medi-Cal umbrella. State plan refers to the single document that details the services that the Medi-Cal program provides Californians who are Medi-Cal eligible. And there's a link here to the California State Plan. Federal financial participation, that's also known as FFP, and that's when the federal government provides funding for Medi-Cal services. And so it's money a state receives for participation in the Medicaid program. And then there are state-only Medi-Cal programs as well. Next slide, please. So there are different Medi-Cal service delivery models that we want to identify to you. So fee for service Medi-Cal versus managed care Medi-Cal. So fee for service Medi-Cal is what's known as traditional Medi-Cal. So if you're eligible for Medi-Cal and fee for service Medi-Cal, you can go to any Medi-Cal provider to get your Medi-Cal services. And then Medi-Cal managed care is that when one single provider provides all your Medi-Cal services. So again, it's more like a health maintenance organization, so that one system provides all your care through Medi-Cal. And there is a link here to um, the Medi-Cal managed care systems in California, the different types or the different counties and what kind of Medi-Cal managed care systems you can get in those counties. Next slide, please. Um, so Medi-Cal services. So there's full scope Medi-Cal versus restricted Medi-Cal. So full scope includes like in-home support services, nursing home. I mean, basically any services that are medically necessary and covered through Medi-Cal, you're able to get. And then it lists those programs that you can access through full scope Medi-Cal. If you have restricted Medi-Cal, it could be for a specific reason. It could be for emergency care, pregnant-related services, long-term care, things like that. So it's restricted to a specific service. Next slide, please. So this is Medi-Cal services continued. So the list of essential Medi-Cal services, there's a link to a document here, a couple of documents that will provide you information about what Medi-Cal services are covered in the Medi-Cal program. There's an advocate's guide to the Medi-Cal program, which will also provide you information about what services are available through Medi-Cal. Next slide, please. Okay, Medi-Cal services. What does medical necessity mean? So a service if you're an adult is medically necessary if it is reasonable and necessary to protect life, to prevent significant illness or disability, or to alleviate severe pain. So that's the medically necessary definition in the adult program. So for children and young adults, it's different. So if you're under the age of 21, it's different. And it's listed as EPSDT here, which stands for Early Periodic Screening, Diagnosis, and Treatment. And that's Medi-Cal for children. It's expanded for children, and the reason for that is so that it can ameliorate and diagnose emerging illnesses and treat it prior to the illness becoming more significant or serious in adulthood. So that's what's covered under the child Medi-Cal rules, which is also known as the EPSDT Medi-Cal program. And here's a link for guidance for the EPSDT program. Next slide, please. So here's we're going to talk now about Medi-Cal eligibility basics. Next slide, please. Okay, so how do you determine what Medi-Cal program you're on? Um, on your Medi-Cal card, you should have an aid code, and here's a link to a Department of Healthcare Services chart, which details aid codes and which program you're on, if related to the aid code that's on your Medi-Cal card. Next slide, please. So Medi-Cal assets and resources. We're going to talk about eligibility. This is another, again, a basic um, requirement for Medi-Cal eligibility is you have limited income and resources. So if you have SSI linked Medi-Cal, that's Social Security income or SSI, um, supplemental security income, or it's called SSI. So it's a Social Security program. If you have social SSI linked Medi-Cal, there are income and resource limits that are related to the SSI program that also are connected to your Medi-Cal benefit. So that countable income and resources are counted under this type of Medi-Cal, SSI linked Medi-Cal. So there are other Medi-Cal programs if you don't have SSI linked Medi-Cal, and each program has its own income rules. And as of town 2026 countable resources are also counted. And here's a link to what those resource limits are. Next slide, please. There's also a program that's detailed on this slide called the Cal Able program. So there's a law called the ABLE Act. It's called Achieving a Better Life Experience. And this is a way for people who are Medi-Cal eligible to save money in an account to pay for medical expenses without affecting your eligibility for either SSI or Medi-Cal. And so you're able to save money in this ABLE account that you can spend on medical expenses for yourself. Um, so that, and then that resource does not impact your SSI or Medi-Cal eligibility. So you can put up to $20,000 a year into this ABLE account, and you can have up to $100,000 total in this ABLE account at any given time. So So it doesn't affect SSI, again, resource eligibility for SSI, Medi-Cal, and other federal programs. So Cal Able is the California program, and there's a link here to that program. Next slide, please. There's also a concept called deeming in the Medi-Cal program. So if what this means is that if you live in a household like with your parents, um, a certain portion of your parents' income is deemed as available to you and could affect your eligibility for Medi-Cal. And so there's parent to child deeming. There's spouse to spouse deeming. So one spouse has a disability and the other spouse doesn't. They deem a certain amount of that spouse's income as available to the spouse with a disability for Medi-Cal eligibility purposes. And then sponsor to sponsor. If a person is an immigrant and they have a sponsor, there's also sponsor to sponsor deeming that happens. So what is deemed as income? And so that's what's important to know here. And there's also resources are deemed for SSI Medi-Cal eligibility purposes. There's also a certain waivers, Medi-Cal waivers that exist in California, and they use a concept called institutional deeming. What institutional deeming is that even though the person resides in the community, if they're on one of these waivers, the waiver um, basically views that person as if they live in an institution. So they don't look at any like family or household resources. They only count that person as an individual who would otherwise be residing in a nurse or a skilled nursing facility. And so they only look at that person's income and assets for eligibility for Medi-Cal. And so these waivers are the home and community-based alternatives waiver, And then there's a home and community-based waiver for the developmentally disabled that also has institutional deeming. And then the self-determination program is a program available to individuals who are regional center consumers. And that's also uses institutional deeming. Next slide, please. So eligibility basics, immigration status. So until the end of 2025, immigration status did not affect eligibility for full scope Medi-Cal. Okay, so all other eligibility rules for Medi-Cal still applied like income rules. Starting in 2026, immigration status may play a factor in Medi-Cal eligibility. So there's the changes that were are coming in 2026 for people with immigration status are listed here. So here's a category chart which details from DHCS, which details immigration status and what's going to take place starting in 2026. Next slide, please. Excuse me. Um, so this slide talks about Medi-Cal programs specific to people with disabilities. So there's modified adjusted gross income Medi-Cal, otherwise known as Magi Medi-Cal. And so that is for people with income levels that are in excess of 138% of the federal poverty level. And that Magi Medi-Cal was created as a part of the Affordable Care Act, which we'll talk about a little bit more, which will become relevant when we talk about some of the changes that are coming after 2026. There's SSI linked Medi-Cal or 1619B Medi-Cal, which is 1619B is if you were on SSI linked Medi-Cal. 1619B is a way that you can maintain Medi-Cal eligibility after your SSI eligibility terminates. There's also a pickle Medi-Cal benefit, which is a specific rule if you were on SSI as a child and then you started receiving an a disabled adult child benefit based on your parents' income after age 21. You can still maintain Medi-Cal eligibility through what's called the pickle program. There's Age and Disabled Federal Poverty Level Program. And again, this is full scope Medi-Cal based on income and resources. And that's full scope Medi-Cal, and there's no out-of-pocket cost to you for that Medi-Cal. There's also a program called the Working Disabled Program. It's called 250%. So if you're a person with a disability who is receiving either supplemental security income or Social Security disability insurance and went back to work, you can get on this Medi-Cal program and not have to pay and pay a monthly premium to be on that program, but not incur what's known as a high share of cost, which I'll talk about here in a minute. There's also the Age Blinded and Medically Needy program. So what this program is for people who have a bit higher income, monthly income, but also are in need of Medi-Cal. So they'll get full scope Medi-Cal, but they could have what's called a share of cost. And so what they do is they calculate your share of cost by looking at your monthly income. There's a um, calculations that's used using the federal poverty level, and they determine what your monthly share of costs would be, which would mean you'd have to pay out of pocket for your medical care until Medi-Cal will start paying for that. So there's again, there could be a share of costs connected with your Medi-Cal in that particular situation. And here's a Medi-Cal category, a link to Medi-Cal categories, Disability 101, which is a great website to go on to look at how your benefits kind of get affected by different events that could happen. Next slide, please. This slide talks about the Deni-Cal program. So Deni-Cal is a service that's available to anybody who has full scope Medi-Cal. Deni-Cal is what's called an optional service in the Medi-Cal state plan. So what happens to often can happen to Denti-Cal when the state budget is being impacted and there's the state doesn't have enough money to run the program. Uh, Denti-Cal is a service that they can drop because it isn't considered medically necessary. It's considered an optional program. Next slide, please. This is vision care, also under the Medi-Cal program, and it's also considered an optional program in the Medi-Cal program. So again, if the state is having trouble with a budget and not being able to afford programs, this is sometimes a service that they consider dropping until again the financial situation within the Department of Healthcare Services becomes more robust. And there's a link to information about vision care and Medi-Cal. Next slide, please. All right, this next slide talks about Medi-Cal and other health coverage. So if you have other insurance, Medi-Cal is what's known as the payer of last resort. So if you have Medi-Cal plus other insurance, Medi-Cal is always going to be the payer of last resort. So Medi-Cal will only pay for services that it will cover and that also um, services that other insurance will not pay for. So examples could be you could have private insurance through maybe a parent or another source. You could also be Medicare eligible. You could also be receiving medical services through California Children's Services. And so these, as I said, these programs like this would be the primary payer, and then Medi-Cal would be the payer of last resort. So if there was something that wasn't covered either through your private insurance, Medicare, or CCS, then it could be billed to Medi-Cal for them to consider paying for it. Next slide, please. So this is what's called integrated care for dual eligibles. So people who have dual eligibility, this would be important information for you to review. And so if you're enrolled in both Medicare and Medi-Cal, you're considered dual eligible. And so there are Medi-Cal, Medicare plans that are available to you. And so they're matching plan policies that are available. So again, this is something to look into. If you have both Medicare and Medi-Cal, there may be ways to get enhanced benefits. And then there's also statewide Medi-Cal managed care enrollment. And here's a link to a Department of Healthcare Services publication on integrated care for dual eligible. So if you're dual eligible, I would encourage you to review this Department of Healthcare Services link to get more information about the integrated care for dual eligibles. Um, Next slide, please. So how do you apply for Medi-Cal? Here's a link to Department of Healthcare Services website where you can apply for Medi-Cal online. You can apply through Covered California, and then Covered California will also, if you apply on their website, if you're eligible for Medi-Cal, should direct you to apply through Medi-Cal through their online system as well. You can apply over the phone, or you can also apply in person at your county Department of Social Services office. You can also mail in an application, and here's a link to the application that you can fill out and mail in. Next slide, please. So now we're going to talk about grievances and appeals in Medi-Cal system. So grievance versus appeal. So this is important to know if, remember we talked earlier about fee-for-service Medi-Cal versus managed care Medi-Cal. So the grievance and appeal processes are different depending on what kind of Medi-Cal you have. If you have fee-for-service Medi-Cal, you can go right to a hearing. There's not a grievance process that you're required to go through. If you have a dispute, if Medi-Cal denies a service and you're a fee-for-service Medi-Cal, you can just file for a state hearing and go directly to a state hearing. However, if you're on managed care Medi-Cal, there is an internal grievance process that you need to go through prior to filing for a state hearing with your managed care organization. So, another thing to highlight here is that eligibility appeals, again, go directly to a fair hearing process, whereas managed care appeals have to go through this grievance process prior to asking for a fair hearing. So if you're in Medi-Cal managed care, what's required is that you file an internal grievance with your Medi-Cal managed care provider. And then if that grievance does not, end up resolving the issue in your favor and you still want to dispute it, you have a few more steps to take. You can ask for an independent medical review at that point, but you can also ask for a fair hearing and and go to a fair hearing. But you must first file a grievance with your Medi-Cal managed care provider before asking for independent medical review or going to a hearing. So when you're filing appeal, important things to remember is that when you're filing appeal, you want to ask for aid paid pending, which means your benefits do not change until after the appeal is heard. And so that's important to know if Medi-Cal is, either reducing or terminating your service. You want to make sure when you file your appeal to ask for aid paid pending. You can also ask for an expedited hearing or appeal request if the need for your appeal is time sensitive. You can ask for an expedited appeal so the appeal takes place and sooner than later. Next slide, please. All right, now we're going to talk about some upcoming changes that we anticipate or we feel are going to be happening after 2026 and the reasons why those changes are happening. Next slide, please. So most of these changes that we're going to talk about are not specific to people with disabilities. However, people with disabilities are part of many different groups, so you're likely to be impacted, again, if you have a disability by these changes, as well as anybody who's in the Medi-Cal system. So we're going to talk about people with unsatisfactory immigration status and then also people who have Medi-Cal eligibility through the Affordable Care Act, or what I talked about earlier, which is called Modified Adjusted Gross Income Medi-Cal. So you can expect many communications for the Department of Health Services in the coming years about Medi-Cal and the changes that are going to be happening. So watch out for those notices. And when you receive them, if you have any questions, make sure you reach out for help to understand what those notices mean for your benefits. And so, yeah, definitely, keep in contact with your county Medi-Cal office to make sure your eligibility doesn't lapse, and you maintain your Medi-Cal coverage. And if the notice is taking a negative effect on your Medi-Cal, like terminating or anything such as that, we recommend that you file an appeal right away, as we talked about earlier, and ask for aid paid pending so your benefit doesn't change until it can determine, if the county correctly, acted in providing you the notice of action with a negative impact on your Medi-Cal benefit. Next slide, please. Okay, so asset limits we're going to talk about first here. So people who receive Medi-Cal through the older adults or disability pathways. So there's going to be an asset limit of $130,000 for an individual. But if there are additional people in your household, then the asset limit increases by $65,000 for each additional person that's added or part of your household. So one car and one house do not count towards your asset limit. So if you go above this asset limit, you no longer are eligible for Medi-Cal until you spend down under the asset limit. So you'd have to spend down those resources under the asset limit in order to start receiving Medi-Cal again. Why did this happen? This happened because of the state budget, and that's the reason for this rule. Because what happened is they eliminated asset um, or resource limits completely, and then they reinstated these asset limits starting in 2026. Next slide, please. So after 2026 enrollment freezes um, for people with unsatisfactory immigration statuses. So this is for people with unsatisfactory immigration status who are 19 years or older, not pregnant, or former foster care youth under 26 and were on foster care on their 18th birthday. So this group will not be able to newly enroll for Medicaid. But if you're already enrolled, you can stay on Medi-Cal. So if you're already enrolled prior to your age 18, you can remain on Medi-Cal. This again happened because of state budget concerns. Next slide, please. So dental coverage is going to be changing for some immigrant groups. So Californians with unsatisfactory immigration status, age 19 and older, will lose Denti-Cal. So non-emergency dental services is what's being eliminated here. Again, the reason why is because of the state budget. Next slide, please. And this is the eligibility changes for certain immigrant groups. So certain immigrant groups, refugees, parolees, trafficking survivors, and similar groups will no longer qualify for federally funded full scope Medi-Cal. So this is due to the federal budget reform act and also the state budget. Next slide, please. So eligibility determinations are going to change to every 6 months instead of annually. And this applies to the Affordable Care Act Medicaid expansion, so people in Magi Medi-Cal. So eligibility, again, reconsidered every 6 months for people in this population who have eligibility through the Affordable Care Act Medi-Cal expansion program. So every 6 months, you're going to have to work with your county medical office to show that you're still eligible for Medi-Cal. And this is because of the Federal Budget Act. Next slide, please. There are now going to be limits to retroactive coverage. So it used to be, again, retroactive coverage was 3 months from application. So this is changing um, in 2026. And this is everybody on Medi-Cal. So every Medi-Cal program is changing to this. So in the federal expansion coverage, there's only 1 month of retroactive coverage from application. And other Medicaid programs or Medi-Cal programs. So there's 2 months of retroactive benefits for people in that category. And this is because of the Federal Budget Act. Next slide, please. So this is dealing with work and community engagement activities, and is a really pretty major shift and change for people who receive Medi-Cal. And this only applies to people who are on the Affordable Care Act Medicaid expansion, so the modified adjusted gross income program. So exemptions include parents of children 13 and under, caregivers of people with disabilities of any age, medically frail people, veterans with disabilities. So people in this group are going to have to report 80 hours a month of work, volunteering, or school to maintain their Medicaid or Medi-Cal eligibility. So verification is required at each application and at each kind of redetermination period, which is every 6 months. So again, this is something that you're going to have to verify if you're on that modified adjusted gross income Medi-Cal. You're going to have to, show how those 80 hours a month are being spent either in school, either in work, volunteering, or school program. And this change is happening because of the Federal Budget Act. Next slide, please. This has to do with $30 monthly premiums for certain people who receive Medi-Cal. So adults with unsatisfactory immigration status. So people in this group are going to have to now pay a $30 a month premium to receive Medi-Cal. This coverage is going to be limited to state-funded Medi-Cal, which will not include dental coverage, except for emergency dental care. And if they miss a premium payment, they will be reduced to just emergency coverage. and this is due to the state budget. Next slide, please. There are going to be $35 for certain copay services now. And this is only going to be for Affordable Care Act Medi-Cal expansion population who make over 100% of the federal poverty level. So certain Medicaid services are going to have a copay of up to $35 for primary care. Oh, hold on here. Oh, so these services will not have a copay. So primary care, mental health, and substance use disorder services will not have any copay. And this is due to the federal budget act. Next slide, please. This is a link to the Medi-Cal Eligibility Procedures Manual, which will again give you additional information on various Medi-Cal procedures, on eligibility. And then here's a link to the 2025 federal poverty level, which will give you the numbers and income amounts for different household size for federal poverty level eligibility. And then there's another link to a website that gives you program eligibility by different federal poverty level limits. And there's also a link to um, an organization called Health Consumer Alliance, which is a non-for-profit advocacy organization helping anybody who's Medi-Cal or Medicaid eligible with health benefit questions or legal problems related to their benefits. And there's a link to that organization here as well. And then Medi-Cal Managed Care Healthcare Options. This is the website to Healthcare Options, which is the agency that manages the Medi-Cal Managed Care Enrollment System for Department of Healthcare Services. There's also information on how to contact the Managed Care Office of the Ombudsman. So if you're in managed care, the Department of Managed Healthcare has an ombudsman's office that can help resolve disputes with your Medi-Cal managed care provider. Next slide, please. So now we're going to see if you have any questions. But first of all, on this slide, we have some information about how to contact Disability Rights California. So we have our contact number for our intake line, and also a online get help form that you can access. And it gives the hours of our intake line when it's open. And then we also have the Office for Clients' Rights Advocacy, or OCRA, intake line. And the Office for Clients' Rights Advocacy provides legal representation and services for people who are served through the California Regional Center system. And so this is the contact information for how to get in touch with the Office of Clients' Rights Intake if if you yourself or a family member receive services through a regional center. And that concludes this presentation on Medi-Cal Basics and upcoming changes. And again, I'd be happy to answer any basic questions about the presentation. And we, again, want to let people know that you shouldn't, if you have individual questions about your Medi-Cal benefits, we'd encourage you to call our intake line and set up an intake appointment with an attorney or advocate to go over that specific question, as we don't want to um, you know, breach any confidentiality in answering individual questions on the webinar today.
Thank you, Todd. So I will be